Hello, and welcome to the second week of the hand therapy elective course. Today, we're going to discuss how to become a CHT, a certified hand therapist, after graduating with your master's in occupational therapy. At the end of this presentation, the learner should be able to answer the following questions. What is a CHT and how do I become one? What is the value of becoming a CHT? And why are there so many criteria in place to becoming a CHT? As a quick introduction, can anyone tell me what CHT stands for? Correct, it stands for Certified Hand Therapist. Certified meaning a clinician who has completed either an OT or PT program and then met the requirements to sit for and pass the hand therapy certification exam, an exam with a 55% pass rate, which speaks to the difficulty of the exam and the required time and resources it takes to prepare for said exam. The requirements mentioned above include practicing for 4,000 hours and 3 years with hand therapy diagnoses, any diagnoses that affect the shoulder, upper arm, elbow, forearm, wrist, hand, or fingers. Despite popular belief, it is not required for a future CHT to practice under a current CHT during this time. It is highly recommended but not required by the Hand Therapy Certification Commission, also known throughout the rest of this course as HTCC. Currently, there are only 6,400 CHTs in America. This speaks to the rarity of the profession and also speaks to why this profession may have a lack of advocacy. A lot of hand therapy patients do not know that certified hand therapy exists until they need one or until they're told to find one. A CHT must either be an OT or PT first, but not all OTs or PTs go on to become a CHT. It's best to see a CHT when able due to the nature of the complex upper extremity. Similar to how one would prefer to see a hand surgeon, maybe over a general surgeon, such as an emergency room doctor, one should consider seeing a certified hand therapist over a general OT or PT. We're going to take a quick break here. We're going to take about 5 minutes if you want to work by yourself or in a group of 2. I'm going to have you review the following link to see what is expected of a certified hand therapist. This link is going to bring us to the 4 domains listed out by the HTCC. I want you to make a list in your notebook or on your computer document of things you see on this website that may have not been covered in your OT graduate program. We will pause class for about 5 minutes for you all to complete this. For the viewer of this video, this is what the link leads to. It's the 4 practice domains required by the HTCC for a CHT. Students in this course should be able to identify some differences on this list compared to what is taught in a typical OT curriculum. All right, now that 5 minutes has gone by, with that list in mind, we're going to answer the question with both the learning activity we just did and the following slide to answer why do I need to put all of this time in? Why can't I just be an OT that treats hands? As you may have noticed through the learning activity, the hand therapy scope of practice is a little bit more extensive in terms of the upper extremity than the OT or PT scope of practice. The Hand Therapy Certification Commission, again HTCC, has determined that it takes a minimum of 3 years and 4,000 hours for entry-level OT or PT to gain the extensive knowledge and experience before even being eligible to sit for the hand therapy exam. Let's have an open discussion now based on the slide we just saw and also what we just looked up on the HTCC website. What do we see that is different on the hand therapy website versus what is covered in a typical OT graduate level program? Just now that 5 minutes has passed, we're about 15 minutes into class now. In summary, what the class has just decided was the 3 takeaway points of the first learning activity was that CHTs have extensive knowledge of the shoulder, upper arm, elbow, forearm, wrist, hands, and fingers. They also have extensive experience with these anatomical structures. Due to their OT or PT background, CHTs possess the ability to assess function and intervene therapeutically. So what we're saying is we maintain that OT or PT background, in this case OT, and just build on it to become a CHT. We're going to do a second learning activity now. What I'm going to do is again have you probably work in groups of two. Feel free to work alone if that's better for you. I'm going to post on this PowerPoint slide an email sent to my hand therapy private practice. This is a new patient just asking a couple questions. I'm not necessarily asking you to recommend treatment for this patient. I'm asking you to read this email through the lens of a CHT and tell me what maybe they would notice after having that extended experience and knowledge that a typical or general OT practitioner may not notice. When reading this email, feel free to consider the following: previous treatment, function, and diagnosis. Here is the email. We can read it together as a class. Kevin writes, I am a professional rock climber, and I saw on YouTube and Instagram that other professional rock climbers were doing wrist curls with 15 to 30-pound dumbbells. This gave me tendonitis, it turns out, but I did not know what to do next since I learned this from other professional athletes. I was confused why I was hurt, where I should go, and if I could keep climbing. I was referred to by a friend who is also a climber. Can I book an evaluation with you sometime this week? I'll have you break away for another quick 15, or not 15, excuse me, another 5 minutes here to kind of dissect this email. Again, the points that we're focusing on. Has he been self-treating? If he has, did this advice come from a CHT? If this advice had come from a CHT, would anything been different? Function, again, one of our summary points was that CHTs pull on their OT background. And diagnosis. What does this diagnosis mean to a CHT? Are we sure that this diagnosis is accurate? Where did this diagnosis come from? All right, now that 5 minutes has gone by and we're about 20 minutes into class now, let's dissect that email in a quick group discussion. First, Kevin tells us he's a professional rock climber. As many of you have noticed, he's speaking to his occupations. We need to create a plan of care in this scenario that keeps him climbing or gets him returned to climbing. Again, building on that OT background with our extended CHT experience and knowledge. He saw on YouTube and Instagram a certain workout other people were doing. We can count this as a previous treatment. However, did this come from a CHT? Would a CHT recommend doing wrist curls with a 30-pound dumbbell? What do we know about the structure of the wrist? Why would we or why would we not recommend this? Again, we don't need to answer that question right now. We're just pulling on why it's important to have extended knowledge and experience when responding to an email such as this one. Next, Kevin tells us that he received tendonitis from doing this workout or previous treatment. This is self-diagnosis, as many of you jotted down. We need to confirm this as CHTs. We don't know where this diagnosis came from. Did he Google it and decided on his own? Did somebody else tell him he had tendonitis? He very well could, but again, we're the experts in the scenario and we need to confirm or deny when we do meet Kevin. Kevin then speaks to his confusion. He didn't know what to do next. Are we advocating enough for our practice? Why didn't Kevin know when he had wrist pain or lack of wrist strength, if that's what he was trying to do, that he should contact a CHT? Lastly, Kevin asks us, can I book an evaluation sometime this week? Of course, the answer is yes. This does seem like a candidate for hand therapy and may be a little bit more extensive than a typical generalized OT or PT patient. We're going to have a final learning activity here. I'm going to have you take about 5 minutes to research private clinic websites, hospitals with CHT websites, LinkedIn, maybe Instagram, if you can find a professional Instagram account, to review a current CHT. You can take about 5 minutes to do this on your own. Come back for a quick discussion to answer the questions. How much experience does this person have as a CHT? Do they specialize in other areas besides just hands? For example, my boss specializes in musicians and I specialize in rock climbers. This is important to know because we have people in the community referring to us, and when appropriate, I need to know another CHT to refer to when the issue maybe is outside of my specialization. And is their experience and knowledge evident on their social media? Again, are we advocating enough as CHTs about the extensive knowledge and experience that we possess? Now that 5 minutes has gone by, we will quickly conclude and then take a multiple choice post test to assess everything learned through this week 2 course. In summary, a certified hand therapist is first a PT or OT who has passed a difficult exam and practiced with hand therapy patients for 3 years and 4,000 hours. A sign of a good medical professional is one who refers out when appropriate. An OT or PT can treat, this should say hand therapist, excuse me. An OT or PT can treat a hand patient, excuse me, wow. OT or PT can treat a hand patient, but when maybe the injury is a little bit more complicated, they should know to refer out to a CHT. There's a quick example here. Feel free to read it on your own. It's basically saying a PT referred to an urgent care, referred to a CHT, who referred to a hand surgeon. This cycle should be normalized and we should continue to advocate for it. What I'll have you all do now with our remaining last few minutes here is please take out a piece of notebook paper, number it 1 to 5. I'll post each question and you'll answer it accordingly. And then I will go backwards through the 5 questions and we'll answer them as a class. First question is how many hours and years is required to become a CHT? Please pick option A, B, C, or D. Question 2, how do I become a CHT after becoming an OT? Again, please pick option A, B, or C, or D. Question 3, why should I encourage upper extremity patients to see a CHT instead of a general OT or PT? Question 4, why is it important to spend so much time on becoming a CHT? Question 5, please match one of the letters on the left with one of the numbers on the right. Which patient would most likely be referred to which medical professional? And extra credit, everybody should know the answer to this one. What does CHT stand for? All right, now that everybody's finished, the answer to number 1, as repeated many times throughout this PowerPoint, is option A. It's 3 years and 4,000 hours of practice before sitting for the exam. Here, many of you seem to have put option A. This is a common belief, but not necessarily true. We do not need to practice under current CHT. It is highly recommended, but not required. The correct answer here would be B, practice for the mandated time and pass the hand therapy exam to become a CHT. Why should I encourage upper extremity patients to see a CHT? CHTs have extensive knowledge and experience pertaining to the upper extremity, option A. The other options are not true at all. Health insurance should not change for CHT or OT. OTs and PTs that don't have time should refer out, but this is not necessarily the best answer here. OTs and PTs do know a lot about hands, just maybe not as much as someone who has become a CHT. Here, the correct response would be D, both B and C. That's pretty self-explanatory after this presentation. If anyone has any questions on this one, please feel free to send me an email or see me in office hours. Our final question here, pain in fingers when typing. You would likely see a CHT. They can assess you ergonomically and then treat the fingers. Wants to crochet for leisure. If the issue is leisure occupation, it's completely fine in this case scenario to see a generalized OT. If the issue was we have pain while crocheting, maybe we would see a CHT. That's not necessarily what's included here. Open laceration with active bleeding, you would go to urgent care. An OT, PT, or CHT, all very highly trained to dress the wound. However, active bleeding normally would require stitches, which we would need to see a doctor or nurse practitioner for. Neck pain and stiffness, that would usually go to a PT. Here, everyone should know this one, certified hand therapist. Lastly, a couple references for your review. Again, any questions on this lecture, please feel free to see me in my office hours. We'll see you next week in week 3 of this course.